Welcome to The Imposters. This is a podcast about expertise. Who gets to define it? Who gets recognized as an expert? And whose knowledge is overlooked in humanitarian and development spaces? The Imposters recenters aid around affected communities and lived expertise. In each episode, I speak with refugees, migrants, and Global South practitioners whose expertise is shaped by experience, context, and leadership. These conversations explore what expertise and legitimacy look like in the sector, and how imposter syndrome is often a systemic outcome rather than a personal failure. Each guest joins the Imposters, an archive of lived experience experts in global development. We are a growing network of practitioners committed to elevating lived expertise in humanitarian and development work. I am your host, Najlaa Raouf. Welcome to the Imposters. Okay, so today I'm joined by Najlaa Dawod. Najlaa is an Eritrean humanitarian practitioner and consultant with over 9 years of experience working alongside refugees and displaced communities across Egypt, East Africa, and the Middle East. Born in Sudan and shaped by cross border movement, her work sits at the intersection of lived experience, protection leadership, and community centered humanitarian response. In this conversation today, we talk about imposter syndrome in humanitarian spaces, refugee led organizations as experts in their own right, and what needs to change for lived experience to be recognized not symbolically, but structurally. I'm so excited to welcome Najlaa today. Najlaa, how are you?
Thank you, Laila, for having me. I'm doing well. Thank you so much for this opportunity.
Yeah, I'm really excited for us to talk about imposter syndrome, but maybe on a more systemic level in terms of organizations, specifically refugee led and community based organizations. But before we get into that conversation, I always start the podcast with one grounding question, which is: do you ever feel like an imposter working in humanitarian spaces?
Oh, that a question. To be honest, feeling an imposter started even before working in humanitarian systems or organizations. Back when I was like a teenager, feeling like I'm not Eritrean enough. As Eritrean, I was born in Sudan. And within my community, we have this division of like you're born in Saudi Arabia, you're born in Sudan, you're not Eritrean enough. You didn't suffer the way that our community suffers. And I already felt like that. And also having the opportunity to access education, to access higher education, and all of that, I was already feeling as an imposter before even joining humanitarian organization. And then seeing there, like to be in that system and to feel like you're not part of your community and at the same time you come with your experience that for them is not validated, it was something that it was like quite difficult to navigate, right? So I was not a refugee myself in Egypt. I was a migrant, but my parents were refugee when they crossed the border from Eritrea to Sudan in 1985. And then I come from this displacement background, but I'm not a refugee, but I was born in Sudan, but I'm not Eritrean enough. And all of that, it was just a mix of feeling that I'm not there as someone coming from that background, but I am someone with qualification and I love what I do and I'm doing it, but I don't have that validation, you know?
Yeah. I thank you so much for sharing that. That is really interesting. And as I get deeper into this season, I'm hearing so many parallels between my participants' conversations and also my lived experience. I've talked about this on the podcast, but I can relate to you of kind of having migration and displacement in my family background and having that impact on my life and having that lived experience without being like a migrant or refugee myself. And the point that you made about feeling like you're not Eritrean enough, like, wow, that totally resonates with me because My father is from Egypt, my mother is American, and I was born and raised in the United States, but, I don't look like a typical Alabamian the way they expect Alabama kids to look. So, I always felt like growing up that I was not American enough, but then when I go to Egypt, I receive the reverse questions, which is like, I'm not Egyptian enough either. And it does, at least for me, that is what created the imposter syndrome from the very beginning. And then once I transitioned into humanitarian development spaces, it created like a whole new layer of imposter syndrome, like kind of professionally. Um,
Yeah,
Anyway, I wanna
yeah,
talk a little bit about your how that foundation starts, like, bleeding into your work. So, your life and work have been shaped by cross-border movement and displacement. How did those early
yeah.
experiences shape the way you understand humanitarian work and belonging?
As working in the humanitarian sector, as like coming from both migration and refugee background, and what really shaped it that seeing myself having this access to education, access to different form of services, while my cousins were like coming from Eritrea, let's say, or like even someone coming from Ethiopia or Somalia, not having that access to a lot of things as the way I had. And it just because of their status, because of how systems are working, I felt back then that okay, why is this happening? Why the lack of access to very fundamental rights? And at the same time, um, these were the moment because, okay, back Najla in 2015 was Najla that felt like, I did this because I'm very good. I did this because, I am ambitious. I did this because like I was like a very good student. But when I grew up, I noticed that, no, Najla, you didn't do that. You had this opportunity. Those people who are just like you didn't do that because you're very good, but it's just your situation, your circumstances that was there. The opportunity that you had, they could have it as well, but they were denied these opportunities. And for like a very long time, I was seeing youth are just lazy, are not doing enough while I was doing the good work. But when I started to work in organization and I see all the obstacles, let's say the systems, the things that in place that prevented these youth from even like finishing their high school, going to higher education, finding work and employment opportunities, all of that, I was like, okay, maybe Najla, you're not very good. It was just things happened for you and they might not happen to someone else, right? And I think this the moment that really led me to doing what I did in the last 9 years.
I like how you kind of frame that around laws and access. And by the way, you are very good. You are kind of like exceptionally amazing at what you do, at least from my experience working from you with you. But I also understand your point in that like our laws dictate opportunity, full stop. And then you can also think of it as our laws dictate then belonging. I'm sure
Yes.
because you work now as a consultant for refugee services, I'm sure you've seen there's like so much research and effort put into like how do we facilitate belonging among refugee communities? And maybe it's not that complicated. Maybe our laws dictate belonging and they're the source of whether or not people belong. And then everything else, all the social
Yes.
symptoms of that are kind of the consequences of really just our laws and our policies.
Yeah, exactly. And I think and it's not only law, it's how even fund, if we can talk about it. Like really fund is dictating what should work, what is not working, right? So let's say any country have this agenda on their government agenda, right? And they want to only fund particular, let's say, project or sector, and then that also diverts attention. and diverse and drive attention, I mean, and drive work and drive opportunities and drive, So I think it's like multiple layers of things.
Yeah, absolutely. That's true. Even like the funding agendas, the priorities of the country will also dictate access and resources and belonging as well. You've worked both within organizations and then also alongside communities. What moments or transitions most shaped your path into protection and community centered work?
My master thesis, I think back then. So it was a tuberculosis cases back in 2017, and seeing a lot of patients from specifically Eritrea and Ethiopia falling into a disease that already was there, like there is medication and there is cure, and it's not, for example, Egypt as a country has been eradicated for years and years. But seeing cases from these communities, and the case reached to a point where for a month and month, 17 years old girl was sick and she didn't have access to the hospital because of language. Every time she goes, she was describing to the doctor that she's coughing. But with that, the doctor was just thinking of that as it's like cold and flu, right? And nobody put mm, even the doctors in the right direction that this person is coming from that background. So maybe this is not cold and flu. Maybe this is tuberculosis. Maybe this is something that, okay, Egyptian physicians are not familiar with because they already work hard on eradicating that disease. And I remember when I visited the physician of that hospital, and he said that they are trying to see what is happening within this community that is somehow activating these genes that they do have extrapulmonary tuberculosis, which in Egypt is very rare. So in Egypt, they do have pulmonary TB, which is okay, and they treat it, but they don't have cases of extrapulmonary. And so for them, seeing a lot of cases coming from these communities, it was something that they needed also to research and to work on. And for me, it was like this girl who's 17, who's been in bed for 8 months after she was already receiving the medication. She had to take like 1 year medication, right? And she was in like bedridden for almost a year. And I was like, how, why someone would suffer like this from a treatable disease? It's like, for me, I don't understand it. Maybe because I come from a nursing background. Only that was the first case that I handled. And after that, I become the expert in that. And I had my master thesis in quality of life among African refugee with tuberculosis. Because it was something that I was like, we can have cases dying from treatable disease. And I think that also somehow was like one of the moments that really devoted me to like, yeah, I need to work on this specific area. I need to raise awareness. And I started to raising awareness in the community, going to the community center. I go with my flip chart and with my thing, and I go and I do like, awareness session about TB and about the importance of like you mentioning to the doctor that you might have this specific, so they would run the test. And yeah, subhanallah. That was like a really long time, but I think it was one of the moments.
That's amazing. So, do you think that this doctor in this case, like, he couldn't diagnose her because he didn't take into account her background, her identity, which is she was from this community, she was a refugee or at least a migrant, and she wasn't Egyptian, so maybe she had a different, background than him. Is that what you're saying?
Yes. Exactly. Yeah.
It sounds simple, but I guess it's not that simple
It's
for people
not.
to ask questions about their background and
Mhm.
their identity. But that's amazing that you taught women about advocating for their health within that community.
Yeah.
You mentioned, like, community organizations, and I know, community organizations are a big part of your professional background and specifically refugee-led organizations. So,
Mm.
from your perspective, working with these organizations, what kinds of expertise do they hold that may be overlooked or undervalued?
To be honest, refugee-led organizations are not something new. The term is new, right? When UNHCR defined it like years ago. But refugees communities, they always live together. They always somehow agreeing on some people that they will take the lead. Um, they discuss their matters internally. They live in groups in a specific neighborhood. They're always together because that's how they work and that's how they used to live back in their countries, right? So I think one of the qualities that overlooked or like undervalued is that refugee-led organization can really assess risk, and they have the trust of their communities. They are the first people who refugees go to whenever they face a problem because of the connection they have together. Like, you do have the access that you have there if you're part of the community is amazing. Right now, they organize it in like WhatsApp group, meetings. Um, the support that they give to each other is unique, and that's for a refugee-led organization that give you the knowledge, access to knowledge, that give you access to outreach, to build trust as well, and also you as someone part of the community, you really know what's happening. Let's say, like, if you're an organization and you want to work in specific, they can tell you, like, this is good in paper. It will not work with our community because this is not how we function. This is not how people do things, right? So they give you that expertise that no one will tell you because a lot of projects are very, very good in terms of paper, right? When you do your framework, when you do your project plan, it's amazing. People, or like, let's say organization, most of them, they work on a very superficial layers. And when you go down and you see, okay, you want to provide livelihood to women, so women would go to work and do this and do that, it's amazing. But okay, why women are not going to work? They have children, but the children are staying at home. There's no education. So how they will pay for education? Okay, you have different medium of education. You have government, which is inaccessible. You have community based, or let's say community schools, which is very expensive. And when you go to, like, the roots, you find it's very simple. This woman or this single mother will not go to work because of like very simple reason. And that reason could be solved within community, not by an organization. And I think that what the refugee-led organization are very good at is that they understand their community. They understand the needs because nobody will come and tell you like this is the real cause of my problem. But people will just complain about what is happening, about about the situation as a whole, not about this very specific details of their life, right?
So, how would you say, in your experience, how are humanitarian systems engaging with refugee led organizations now? Do they engage as partners? Do they engage with them as consultants?
To be honest, let's say like in the last, let's say from 2015 to 2023, most of the interaction with community-based or refugee led organization was access, like to bring access, outreach, trust from within the community, you know? Even when, like, in the last 10 years, let's say localization, and 15 years or so, talking about localization and how we can bring local actors to be the best who would lead. Even with that, the power hasn't shifted yet. And I think is more when these organizations think of how we can then share power with our RLOs. The thing is, like, you don't give power, you share power, right? And that's where a lot of problems was happening because INGOs, let's say a humanitarian actor, was feeling that they are given the power. No, like the power of working with community was already there with the refugee-led organization. You're sharing with them that power, right? So I think even with, let's say, in the last 3, 4 years, and with the term of RLOs and how it's it became trendy, and everyone wants to have like this refugee leadership among their partners or among their organization, and all of that. Yeah, I think what refugee-led organization would really want is just to be treated equally, and not in terms just of visibility. And they need to be trusted with resources and treated fairly with resources as well. And also in shaping decision. Because when you work with RLOs, accountability will move closer to community, right? But I think the real accountability falls when you share accountability with refugee-led organization, um, and you become more responsive.
I know the audience can't see us right now, but the whole time I was, like, grinning and, like, violently nodding my head because I agree with everything that you're saying. I'm, like, at a loss for words. You just basically answered all my questions, so having to go off script now. But, I completely agree with you. And I talk about this a lot, and really that's why I created this podcast because I've been tracking the discourse around development and humanitarian work, and I notice that organizations are now putting out their plans and their strategic frameworks for localization. And to me, I do wonder if this is just coming because of the aid cuts. And now they're thinking localization is maybe a pragmatic solution to continue operations on the ground. And I've created this podcast because I think that's not correct. I also don't think it's sustainable. And I also wonder if the funding, resumes in a couple of years, will localization still be a priority? So this podcast and speaking with experts like you is my attempt to refocus the conversation on recentering aid around the lived expertise of these affected communities so that when the funding resumes, we don't go backwards on our pledges to localize and to co design and to collaborate with refugees. And I speak a lot about this
Yeah.
a lot, but to me, if you don't see localization as social justice, then you're not ever going to reach true localization, which, like you mentioned, is sharing power or honestly giving power. Because otherwise, if you're not giving or sharing power, you're withholding power from other stakeholders. And so to me, it's like quite simple. Localization is social justice, which is all about power. And if your localization frameworks have not, you know, thought or analyzed how are refugee communities recognized? How are they represented in collaboration or informal spaces? Is there any representation by RLOs? Then, you'll never be able to truly localize in like a meaningful way that's based on dignity and the rights of affected communities. So, I promise I didn't set you up to validate my research. I just think, we have like a lot in common in that way, which is how we really like got connected anyway. So can you kind of I know you mentioned this a little bit, but I think it's such an important topic. So I'd like to hear you elaborate a bit more. In your experience, what kinds of recognition actually matter for refugee-led organizations? So like from funding, is that the kind of recognition that they prefer? Decision-making power, visibility? So what would you say? What does recognition really mean to refugee-led organizations?
To think about it as a recognition, I would say that a lot of refugee-led organizations are really struggling with even existing, which is like legalization and registration and all of that. Um, it's really hard, and I've been witnessing this in a couple of countries in Egypt and in some of the East African, also in Malaysia. Um, there's really it's a very hard process for refugee-led organization to be registered as RLO, and that's a problem, right? Because of like the documentation and everything. And because of that, also, this prevents a lot of RLOs to be funded. A lot of the major funds and funders that we know, usually the paperwork that is needed to be also eligible for that fund, it's a lot. Whether they do have the registration, then they need also the expertise. to be part of that. These organizations, let's say, like if we talk about INGOs who are receiving this fund, they have hundreds of skillful experts working for them, right? And what does RLO have? Do they have the expertise to apply for this big, huge funds, right? They're just formed in a couple of years. They don't have the expertise. They don't have the best M&E team. They don't have the best systems that will allow them to be considered for funding, right? So first is registration and legalization, and second is also sharing knowledge and sharing skills with refugee-led organization. If we're talking about localization, if you want them to be the local actors and to work within their communities and to develop programs and projects that will really make difference in their life, in their community's life, then we need to empower them. For me as Najla, I see the shifting and humanitarian work is shifting from humanitarian and providing aid into empowerment. You need to empower the people. Empower means knowledge, skills, means, funding, mean all of the resources that will allow them to be part of opportunities. All of these things will open doors for them. So they will step in a world where they are recognized. But if you recognize me as an RLO, but I don't have the fund, I don't have the skills, I don't have, you know, the expertise. How would then, where is the recognition? It's, you know, saying my name out loud will not bring me any recognition, right? And like, for example, let's say in UN meetings and sub working group, when we see bringing refugee-led organization into this meeting, okay, what are you giving them? Did you share the agenda? Did you ask them? Did you talk them how this meeting for you as an INGO, as experience? These are most of these INGO have been there for like more than 100 years, right? They've been training people, and you have all these manuals, you have all this handbook on how to do this and that. You have people who have been, educated, graduated, they take training, you send them out there to learn about one thing or another, right? But when it comes to refugee, you want them to be there and to be ready just on their own, while they're also navigating everything. Maybe some of them had access to education. Maybe they were like, they studied in their home country. But right now, what they're doing is different from their background. What they're doing is advocacy. They are doing that with the passion. They're not doing the passion and the expertise from their lived experience, but they're not doing that as part of something that they really, really studied for or really spent years into it. So how then you can compare expertise, right? When you bring an INGO professional who's been like there for years, who studied at the best university, and you bring someone with their lived experience, they have the knowledge. They don't have the tools. That's the thing, you know? I think that what means when you said like we recognize you as an RO is when you share this skills and knowledge with them.
You make such a good point that when you said maybe we invite them to the meeting, like an NGO might invite them to be a representative in a working group, but we expect them to be able to just kind of like compete as they are. But these are completely different, like levels here. Like you said, INGOs, maybe they've existed for 100 years. That's years and years of restructuring, training, funding professional development. Like it's a cycle of bringing people in, training them, bringing more people in, training and building their organization and building their expertise. And so it's not really fair to invite an RLO to the table and then not to support them so that they can, reach their potential. I could totally see a situation where, you just tick a box like, oh, we invited them and they showed up, but they didn't offer anything. So maybe including RLOs is not that important. Doing them justice by providing the mentorship and support to be able to contribute to these very often very formal, rigid spaces to represent themselves. So that is like a really excellent point, and hopefully as these organizations refine their localization strategies, they consider that. that just simply adding an organization into this pot and mixing it is not enough. There needs to be real thought around how we mentor and train and build the capacity of these organizations so there can be like meaningful collaboration and learning between the
Yeah.
actors. So how would you say, from your experience, imposter syndrome could show up for refugee leaders when systems repeatedly like question their authority or their legitimacy? What is the impact of that?
You feel like maybe I don't know what I'm doing. Maybe I lack the expertise. Maybe this is like beyond me. And I think it just show where like because also we're communities that affected by the what do you call it? I don't know in English, but it's like it's the white man knows better, right? Or let's say like
Coloniality.
westernization. So yes. So we also come from communities that used to worship white men, right? Where like, they have the best um let's say tools, they have the best education system. We in our countries we follow their education system, thinking that they are the best, right? And all of that, you would feel like, who am I to compete with all of these? These are experts. They done their research. They have the resources. They know better. They're well articulated. Well, I'm not that person. So you still feel that you're small in that world, Like this is just effort that we're doing. And within the community, to be honest, people will tell you like, what are you doing? Devoting all of these hours, you're going to this meeting, you're doing this, you know? And within the community, people will go sometimes to INGOs feeling that they will serve us better because they have the resources. So when you as an RO face that, right? When your efforts are not seen or recognized by your community sometimes, that will create a feeling of like, maybe this is not my fight. A lot of people left community work and humanitarian work because they're feeling like maybe this is not the place for me.
I never really thought about refugee communities going to NGOs because they have the resources and how that could create more imposter syndrome around refugee-led organizations to the point where they would leave advocacy work. I mean, that really upsets me. Let's talk about, your experience with mentorship. From your experience mentoring young women, what support makes the biggest difference in helping that leadership thrive?
I think in my mentorship with refugee women and especially youth as well, they don't lack skills, that what I learned, or vision. They just lack like affirmation that their leadership is legitimate. Most of the work for me was like with them is unlearning the need to overperform or to fit into just narrow ideas of what leadership should look like. A lot of them, they would have role model of people different from them and they just want to fit into that. That was part of it. And the second part that was the hardest part is when you work with youth when there is no hope. And if I talk about my work in Egypt, whenever we have the mentorship session, and then like we're putting plans and we're putting things, and it's so hard to give them hope because for them, as someone who's 19, 20, they want to go to university, they can't. They're looking for job opportunities. Most of it are informal. Like eventually they want to resettle or to go to Libya and then, cross the borders. So giving hope to someone who is feeling hopeless and convincing them that they need to stay, let's say in Egypt or in this country and to work their way out and to do this or that. It's so hard, to be honest. Convincing them that no, you don't need to go to Libya. You need to stay here to work on yourself. But at the same time, you cannot give them like a hope or a solution for what is happening. So you see a lot of youth from the age of like 18 to 30 trapped, let's say like trapped in Egypt, where they don't access education, they don't access formal opportunities, employment opportunities, and they're just stuck there. And you're telling them you need to stay here because this is, even with all of this, is way better than you going to Libya and then crossing the borders and and all the risk. So that was the hardest part of my mentorship, is convincing people that this situation with everything around it, is way better than migration or like crossing the borders illegally. So it was hard.
What you mentioned about, like, this concept of hope for displaced youth who are trapped, using your words, in really difficult circumstances, how do refugee-led organizations try to manage that, like, helplessness or maybe that disillusionment that youth could feel?
I think what's the refugee-led organization, to be honest, from my experience, let's say in Egypt, where they're trying to build like a lot of skills in terms of like small programs or projects that could work on teaching they use, I think, a lot of employment skills. They're trying to at least getting them back to schools, even if it's community schools. Also trying to build a lot of livelihood opportunities in terms of like small businesses, small projects. But I think this particular issue is like beyond our laws, right? Because in response to that, with the decreasing number of resettlement and decrease of number of opportunities, what's happening, and the increased number of refugees in Egypt. And I'm giving Egypt as an example because of my work there. Um, Even RLO's leaders sometimes, they want to give hope to youth, but themselves they are feeling hopeless because of like the funding they receive, the work they do. The situation is getting harder in Egypt. The increase of living expenses. To be honest, like they don't sell false hope, right? Or make promises about resettlement. So what they do is they're trying to also hold emotional space for people to feel frustrated, for people to feel heard and seen and validated, because themselves are going through the same thing, right?
Since we're talking about hope, maybe we can end this conversation on a hopeful note by, putting our hopes out there. So for you, with all of your experience, what would a truly community-led humanitarian system look like from your point of view?
Oh wow. That is a good question. I need to think about it. I think from the start, for refugee-led organization to be given the opportunities to also take the lead of what is happening to them and what's happening for them and with them as well. So starting from building projects, funding, implementation, seeing what is best, moving resources, changing how things look like for them is important, because I feel that, let's say, the humanitarian system is about how we can like have a room for our ows within everything happening, right? That I think is not about integrating RLOs within the system. It's about RLOs being the system, and localization of them deciding what is the best. Because localization, or let's say like one system fits everyone, it's not working. If it was working, we will not be here right now working in the humanitarian system, right?
Absolutely.
And I think that what they really need to understand, what working with this community will not work with another community. And because of all everything, their background, their home country, their origin, everything feeds into their identity, their belonging, everything feeds into that. So having them, or having a say in that from the start point to the end point, what I really see is the best. If we fail, we analyze it, we evaluate it, we redo things, we reshape things, we restructure things, right? That system will win eventually.
Yeah, that's so well said. We're coming near the end of our conversation, but I just wanted to say, like, on the topic of hope, people like you make me hopeful, honestly. Like, this conversation makes me hopeful knowing that there are so many people out there thinking and organizing and mentoring with, like, your background and your understanding of power and recognition and representation and the importance of lived experience. Like, it makes me hopeful that we're headed in at least a slightly better direction. So I just wanna thank you so much for your time today. This was really a great conversation.
You so much. I'm just thinking about like how this conversation went, and I was like, two more spaces where people with lived experience talk about their point of view, their knowledge, and their what they want to share. And I think starting that also, what we're doing here, this conversation gives me hope that we are or you are also um, opening conversation around lived experience expertise. And that is something would make things slightly better. Thank you for this opportunity.
Well, as we wrap up, I'm just curious to know, like, what are you working on these days, or do you have any exciting projects coming up that you'd like to share?
Right now, still I work as a freelance. I'm developing training for an RLO in Uganda. And at the same time, I also do a lot of mentorship and coaching session. It was specifically to people from refugee and migration background displacement as well.
Hey.
As I think I told you that I took a break from working full time positions. And I was taking some time to also reflect on my journey, see what I can fit best, what I can do. I'm happy and waiting for the next excited project that I will work on.
Well, such a well-deserved break. If others out there wanted to get in touch with you, what's the best way to connect?
Of course, my LinkedIn, I'm responsive there, and my website. And of course, we can share my emails and my contacts with you.
Perfect. Well, Najla, thank you so much for sharing your experience so generously today. This conversation reminds us that refugee led organizations are not emerging actors waiting to be trained, but experts who have long been sustaining communities and shaping solutions. Thank you so much, Najla, and thanks for listening. And that's it for today's episode. If you'd like to learn more about today's conversation, visit theimposters.org, where you can explore episode resources and browse the wider archive of lived experience experts. Tune in to The Imposters wherever you listen to your podcasts. I'm Lila Raouf. Thanks so much for listening.